Okay, so in the previous video, we have discussed the non-cell cycle specific drug, that is DNA alkylating agents. So in this video, we'll be discussing another group of drugs which are non-cell cycle specific, and they are called as platinum compounds. So these are called as platinum compounds. So in platinum compounds, the major drugs are cisplatin. So you read the name, their name end with platin. Then we have the carboplatin. Then we have one more drug, oxaliplatin. So all their name end with platinum. So they are platinum compounds. Now, sir, what is the mechanism of action? How do they work? Mechanism of action, how do they work? Now, this is inside the cell. Inside the cancer cell, what happens? When we give these platinum compounds, the drugs enter inside. These platinum compounds are also called as platinum coordination complex. So these platinum coordination complex, they enter inside the cell. They are broken down in the cell. Once they break down in the cell, they release highly reactive moieties. Highly reactive moieties, and what do? They bind to N7 guanine residue in DNA. Now, once they bind here, what do? They cause cross pairing in the DNA. Now, what happens in cross pairing of DNA? That will lead to DNA damage, and that will lead to cell death. So they have the same mechanism like DNA alkylating agent, but here instead of the alkylation, they have platinum compound. So they are called platinum coordination complex, and the drug name is cisplatin. Now this is one of the famous drug the examiner is favorite to ask. So let us understand the drug by the name cisplatin. So should I go with in detail mechanism of action? Remember, cisplatin also binds to N7 guanine residue. It causes cross-linking or cross-pairing and DNA damage. That's it. Now let us understand the drug cisplatin. One of the commonly used anti-cancer drug, most widely used anti-cancer drug, cisplatin. Now, why it is widely used? If you know the uses, then you will understand. So you can remember by the mnemonic, he got bladder cancer. The uses you can remember like this: he got bladder cancer. H for it is used in head and neck cancer. E for esophageal cancer. C for the gastric cancer. O, remember it affects the ovarian cancer also. It is used to treat ovarian cancer, testicular cancer, and the last one itself is written there, the bladder cancer. So it is widely used for managing head and neck cancer, esophageal cancer, gastric cancer, ovarian cancer, testicular cancer, and bladder cancer. So he got bladder cancer, head and neck, esophagus, gastric, ovarian, testicular, and bladder cancer. So what is commonly asked in your exam is the adverse effect of the drug. Very commonly asked. It is also most emetogenic anti-cancer drug. If they ask you which is the most emetogenic, cisplatin, then comes cyclophosphamide. So first is always cisplatin, and it also causes ototoxicity. Can you tell me some antibiotics which can cause ototoxicity? You are right, vancomycin, amyloxicillin, and this drug, cisplatin, also causes ototoxicity. The drug is also causing nephrotoxic. So it can damage the kidney. So to prevent this kidney damage, what we do is we do something called forced chloride diuresis. Now, how to induce diuresis faster? So we have to use mannitol with sodium chloride. So what happens in the presence of chloride? This cisplatin will not stay for longer period in the kidney, so it will be thrown away. So that is called forced chloride diuresis. So that will not allow cisplatin to stay in the kidneys for longer time and prevents nephrotoxicity. So we use mannitol with sodium chloride. Forced chloride diuresis. And one more thing, what we use is amifostine. So amifostine is a radioprotector, but it is also used in the management of cisplatin nephrotoxicity. So that is amifostine. So one of the most emetogenic, ototoxic drug and nephrotoxic drug. And one more important thing is it is also neurotoxic. Okay, sir, it is neurotoxic, but what does it produce? It produces mainly peripheral neuropathy. Peripheral neuropathy. Sir, what do you mean by that peripheral neuropathy? Now, patient will have the tingling and numbness sensation. Not only that, this effect will remain even after you stop the drug. Usually what happens when you give the drug, the adverse effect will be there. But when you stop the drug, adverse effect should stop, but it will remain. Even after you stop the drug, the adverse effect remain. That effect is called coasting effect. So if they ask you in the exam, what is the coasting effect of cisplatin? That means if you stop the drug, adverse effect should stop. But the adverse effect remains still even after stopping the drug. That is called coasting effect. The least important one is electrolyte. So it can decrease the major electrolyte like potassium, calcium, and magnesium. So when you are giving this, you have to monitor these things. Very much important. It is most emetogenic, ototoxic. Nephrotoxicity can be prevented by forced chloride diuresis and using a drug called amifostine. Neurotoxic and electrolyte abnormalities can be seen. Then similar to this drug, we have another drug and the name is called oxaliplatin. Oxaliplatin is used to treat a cancer called colorectal cancer. It is used in colorectal cancer, that is about platinum compounds. So mainly concentrated on cisplatin. One more C you have to concentrate on is cyclophosphamide. So once we are done with platinum compounds, another cell cycle non-specific drugs, we call them as anti-cancer antibiotics. You may be wondering, sir, we thought antibiotics are to kill the bacteria, but antibiotics are also going to kill our own cell, that is cancer cells. The only thing is I told you antibiotics means they are obtained from some organism and kill the other organisms. That's it. So if they are killing the cancer cells, they are called anti-cancer antibiotic. In that, number one, we have a drug by the name bleomycin. Sir, you told bleomycin in cells cycle specific. Yes, I told you. But since I am discussing anti-cancer antibiotics, I want to discuss it here. It is G2M specific drug. It is G2M specific drug. And what is the mechanism of action, sir? Remember, simple. All anti-cancer antibiotics, they damage the DNA. That's it. Simple word. All anti-cancer antibiotics, they damage the DNA. That is their mechanism. But how do they do that? It induces free radicals. So it releases free radicals, and these free radicals breaks DNA strands. So these free radicals induce breaks in the DNA strands. So it will cause breaks in DNA strands, and that is the mechanism of action of bleomycin. In simple words, DNA is damaged. That's it. Now, what is the specialty, sir? Specialty is it's a bone marrow sparing drug, and we have discussed that. The next important aspect is where to use it. It is used in testicular cancer. Testicular cancer, we use a regimen called BEP regimen. BEP. B stands for bleomycin, E stands for etoposide, and P for platinum compound. The platinum, P for platinum, the most commonly used is cisplatin. That is where we use it. So it is used in testicular cancer, and also it is used in Hodgkin's lymphoma, HL, and you know the regimen we have discussed that ABVD, And B stands for bleomycin. We have discussed that already. Yes. Sir, any adverse effect with the drug? Yes, this drug adverse effect is frequently asked. It is asked now, it was asked when we were writing the entrance exam. Two important problem is it can cause pulmonary fibrosis. Pulmonary fibrosis, that is lung fibrosis. Can you tell me what was the other drug which starting with B, an anti-cancer drug which can also produce this problem? You're right, busulfan. So it can cause pulmonary fibrosis. In the lung, we have two types of cells, type 1 pneumocytes and type 2 pneumocytes. Type 1 pneumocytes and we have type 2 pneumocytes. So what does it affect more? It causes necrosis of type 1 pneumocytes. Type 2 pneumocytes will undergo hyperplasia. This question was asked. So it mainly affects the type 1 pneumocytes. Now what about amidron? Amidron affect type 2 pneumocytes. These are the questions which we can expect in the future exams. Now one more typical adverse effect is a dermatitis which is seen and which is seen like flagella. It is called as flagellate dermatitis, which is seen in the back, buttocks and everything. And recently this question appeared in the exam. Which drug causes flagellate dermatitis? The name is bleomycin. So bleomycin, remember, for the adverse effect, pulmonary fibrosis and dermatitis. And also it is bone marrow sparing and it will damage the DNA. That's it. And it is cell cycle specific. Now other anti-cancer drugs, what we are going to discuss, what are those? They are called as anthracyclines. The group name is anthracyclines. In anthracyclines, before I come to that, what is the mechanism of action? Simply remember, they also damage the DNA, but how they damage the DNA is the point. So what do? They intercalate into DNA. So into the DNA they intercalate and then they form a breaks in DNA. That is one thing. Second important thing is they induce free radicals. So free radical injury to the DNA can be caused. And third, they inhibit an enzyme called DNA topoisomerase 2. So all this will lead to DNA damage, and the DNA damage will lead to the cell death. So that is the mechanism of action of the anthracyclines. Sir, what is that anthracycline drugs? How do they sound like? These anthracycline drugs end with rubicin. You already know them. Daunorubicin. And one more is called doxorubicin. I think you heard of these drugs already. So daunorubicin and doxorubicin. Daunorubicin has a ruby. It is also called as rubidomycin. Now you should answer this question. Doxorubicin is also called as, yes, it is also called as adriamycin. It is also called as hydroxydaunorubicin. It has different name. Then we have idarubicin and valrubicin. The major use of valrubicin is in the management of bladder cancer. And do you know where to use this doxorubicin? In lymphoma. Mainly it is used in the treatment of both Hodgkin's and non-Hodgkin's lymphoma. We use this drug. Okay, so they end with rubicins. Sir, what is the adverse effect of these drugs? Are they commonly asked? Yes. The adverse effect of these drugs are they can produce cardiotoxicity. They are cardiotoxic. How do you prevent? Why the cardiotoxicity occurs? Because of the free radical. What is the free radical? Iron free radical. So to prevent a cardiotoxicity, we have an iron chelator, and the name of that is called dexrazoxane. It is called as dexrazoxane. Zoxane. Now, what is the dextrozoxane? It's a iron chelator. It's a iron chelator. Sir, what does it do? It will chelate iron and prevent the free radical injury to the heart. So that is the reason why we use it. So one adverse effect is cardiotoxicity. The second adverse effect is these drugs can produce a problem called radiation recall syndrome. Sir, what do you mean by radiation recall syndrome? Suppose I told you when we are using an anti-cancer therapy, along with the drug, sometimes we have to give radiation therapy. Sometimes after we have done surgery, we also give radiotherapy. When you give radiotherapy, they are radiation. They induce mucosal damage, skin will become red, itchy, all those things. That is seen due to radiotherapy. But once the patient has undergone radiotherapy and the lesions have gone, but again when you give these drugs, patient will get the same lesions back, and that is called radiation recall syndrome, and that is seen with anthracyclines. So both of them are asked commonly in your exam, the cardiotoxicity and radiation recall syndrome. Clear? Yeah. Sir, are there any other anti-cancer antibiotics? Yes, we have something called actinomycin D. Now, you check the name, you add the D here. Actinomycin D is also called as dactinomycin. See, one drug has two names. What is the mechanism of action? It also intercalate in DNA. But here, instead of doing the DNA damage, it inhibits RNA synthesis. It inhibits RNA synthesis, the specialty of actinomycin D, or it is also called as dactinomycin. Now, what are the other drugs in anti-cancer antibiotics? Mitomycin C, which will also damage the DNA. But the question asked is, where do you use it? It is used in tracheal stenosis. So not used. It is used to prevent tracheal stenosis. What happens when you are doing the surgery? The tissues may proliferate and stick, and there is stenosis. So what we do after surgery, we put this mitomycin topically, so the cells will not proliferate, they will not stick. So they will prevent the stenosis in case of trachea. They are also used to prevent nasal stenosis. Yes, and are also used during strabismus surgery. Strabismus surgery. Sir, why do we use it in strabismus surgery? To prevent scarring. To prevent scarring. So scarring should not happen after strabismus surgery. Why do you use that in stenosis? To prevent adhesions. Adhesions. So remember, after tracheal surgery or nasal surgery, we apply it topically. So it is also written as laryngotracheal stenosis. So the drug is also used as a drug for laryngotracheal stenosis. So recently the question had come, what drug is used to prevent stenosis? The name is mitomycin C. It is extensively used in ENT practice. And that's why they had asked. We don't know whether it is from pharma or ENT, but the question had come. So you should be knowing this. One more anti-cancer antibiotic is called mitramycin. Mitramycin is not used as an anti-cancer drug, but it is used to manage a complication called hypercalcemia. Hypercalcemia it is used. One more is called mitoxantrone. It is called mitoxantrone. But most important, they will ask you the adverse effect of this. It will cause bluish discoloration of the skin. Okay, the sclera will become, and let me write, bluish discoloration of sclera. Nails will become bluish, and even the eyes looks bluish for them. Right? Not so much important drug. Remember, it will cause discoloration of the eyes and skin and nails. That's it. Mitramycin is used for hypercalcemia. So this is an additional drug, but main drug you should remember is mitomycin C. Very, very important. And remember the adverse effect of anthracyclines, cardiotoxicity and radiation recall syndrome. And remember the adverse effect of bleomycin That is the one which you have to concentrate more. That is about anti-cancer antibiotics. Okay, so in cell cycle non-specific drugs, the last one which we are going to discuss are miscellaneous group of drugs. Miscellaneous. So in miscellaneous, we have an enzyme in treatment, and that is called L-asparginase. L-asparginase. Now, as the name suggests, it's a L-asparginase, means it will cut the L-aspargine. Now we know that L-aspargine is required for us for protein synthesis. Now let me tell you the idea why the scientists developed this. Now let me tell you, this is the normal cell and this is the cancer cell. Now the cancer cells have to rapidly multiply. So if they have to rapidly multiply, they want amino acid from outside, and so that they can synthesize protein and they can multiply faster. So they lack an enzyme called L-aspargine synthase. They lack an enzyme called L-aspargine synthase. This enzyme is deficient in cancer cell. So since it is deficient, what they will do, they will take L-aspargine from the blood or from the environment nearby. So this will go into the cancer cell and they start multiplying. But normal cells, they can synthesize their own L-aspargine. They have time also. So now what happens when you use L-asparginase? This enzyme will go and cut the L-aspargine. Now when it cuts that, the supply of L-aspargine to the cancer cell stops. If L-aspargine doesn't go to the cancer cell, what happens? They cannot synthesize protein. If they don't synthesize protein, they cannot divide, they cannot multiply. So the cancer multiplication stops. Normal cells, they have time, they can synthesize the L-asparginase, so they are not affected much. So that is the specialty of developing an enzyme L-asparginase. L-asparginase, which will cut the L-aspargine and make it deficient for the cancer cells so they don't multiply. Now the specialty of this is it's an enzyme, and remember in pharmacology anything ending with ASE is an enzyme, and again it is a bone marrow sparing drug. Very good. Then it is known to produce certain adverse effect because it's an enzyme. It can cause allergy. Because when you are using an enzyme, they can induce allergy in the patients, and it can also cause pancreatitis, and it can cause increased clotting, So these are the adverse effect of L-asparginase. Now usually we use L-asparginase. Okay. So L-asparginase is an enzyme. It has bone marrow sparing effect. It causes allergy, pancreatitis, and increase the risk of coagulation. Now where to use it? It is used in the name starts with LA. So it is used in treatment of childhood ALL. Okay, it starts with LA. The use is ulta, ALL. That is L-asparginase. So the next important miscellaneous agent which we are going to discuss is by the name tretinoin. It is called as tretinoin. What is the other name for tretinoin? It is also called as all-trans retinoic acid. It is called as all-trans retinoic acid. In short, we write it as ATRA. And the stage is called M3 stage. So it is called as acute promyelocytic leukemia. It is used in acute promyelocytic leukemia. Okay, sir. What is normal? Now we know that the immature cells, myeloblast will become the mature ones. The cells are not differentiated, they are undifferentiated and they multiply. So that is why they are called acute promyelocytic leukemia. Now normally, in the normal cells, what happens? We have a nuclear receptor, and the nuclear receptors are like this. So there is RAR alpha, which binds with RXR, and that is leading to differentiation of cells. So the myeloblast will become the mature one if this is normal. So we will have the normal cells coming to the circulation. But in cancer, that is promyelocytic leukemia, acute promyelocytic leukemia, what happens is this RXR is not there. So what happens? The PML will bind with RAR alpha. It binds with RAR alpha, and what happens? It inhibits the differentiation of cells. And now the cells are stuck in the blastic stage or promyelocytic stage. So this is the problem. You understood the problem here. Normally this is what we see, but in cancer this is what is happening. What happens when we use this drug ATRA? ATRA, what does it do? It is called as differentiating agent. All trans-retinoic acid is called as differentiating agent. What happens? It will bind to RAR alpha RXR. So it will bind to this very tightly binds to that. So if it binds tightly, what happens? The cells will undergo differentiation. The cancer cells will undergo differentiation. That's why it is called as differentiating agent. What does it do? It also binds the PML RAR alpha. So what happens when it binds to this? It will degrade this. So if that is degraded, the cells will also undergo differentiation. So two important effect we see with ATRA. It tightly bind and it will proliferate this phase, so differentiation occurs, and it also binds to the PML RAR, which is seen in cancers, and degrades them and allow the differentiation of cancer cells. So that's the reason it is called as differentiating agent, that is tretinoin, also called as all trans-retinoic acid. So the condition is called PML M3 stage. So what we usually give is, along with ATRA, we add anthracycline, that is called doxorubicin. So this combination has very good efficacy up to 95% when you are managing acute promyelocytic leukemia. So that is about tretinoin. Now one more similar drug which is used in the management of this condition is called arsenic trioxide. Arsenic trioxide, it is also used to treat the acute promyelocytic leukemia AML, that is stage M3. Now what does it do? This is known to produce DNA damage and thereby kills the cancer cell. So another drug is called arsenic trioxide. So we are done with miscellaneous agent. One is the enzyme L-asparginase, then all-trans-retinoic acid and arsenic trioxide. There was one drug which was forgotten by many doctors, and that is called thalidomide. So thalidomide was withdrawn from the market. You know the reason for that? It was teratogenic. So it was used for morning sickness. Not now. I am telling the history. When it was used for morning sickness in pregnant women, the adverse effect what was seen was phocomelia or C-limb deformity. Because of this reason, the drug is contraindicated in pregnancy. So the drug is thalidomide. Now later, it was found to produce the immunomodulator property. It had immunomodulator property. Not only that, it also had anti-cancer property. So that's the reason it is used for other conditions nowadays. Now where do you use it? Uses. It is used in multiple myeloma. And can you recall any leprosy we use it? Yes, it is used in recurrent ENL. Erythema nodosum leprosum. If it is occurring repeatedly, the drug of choice is thalidomide. We all know that. Then it is also used in HIV associated ulcers, associated mouth ulcers. And what is a condition where there is mouth ulcers? That is called Behçet's disease. It is used in Behçet's disease. So these are the important uses of the drug. But what is the adverse effect? The adverse effect, we all know it is teratogenic, so don't use it in pregnant women. That is a major thing. Now you may ask a question, sir, why was it used in morning sickness? Because it was a very beautiful sedative. So it used to sedate the brain and decrease vomiting. So it was causing sedation, and problem is peripheral neuropathy. So one of the exam they had asked, can we use it in treating peripheral neuropathy in HIV patient? No, because it itself causes peripheral neuropathy. So this question had come, and drug can produce constipation. So even the drug is outdated, but still we are using it in many conditions. So these are the major uses what we have learned. Similar to thalidomide, we have a drug, and that is called lenalidomide. It is called as lenalidomide. It is called as lenalidomide. Now, lenalidomide is also used to treat multiple myeloma. But there is some advantage. What is that? It causes less adverse effect than thalidomide. Less adverse effect than thalidomide. What you have written, the constipation, sedation, that is less. And this drug lacks teratogenicity. So that problem is not seen with lenalidomide. So that is the specialty of this. So until now what we discussed, they are all cell cycle non-specific drug. In this video we discussed, what did we discuss? The platinum compounds, then anti-cancer antibiotics and miscellaneous one, and explained what is important in that. So remember the main drug cisplatin, then remember the L-aspergillus, bleomycin, the adverse effect of it, then anthracyclines, the adverse effect, and how do you prevent cardiotoxicity by using dexamethasone. Then they can cause radiation recall syndrome. Remember the use of mitomycin C to prevent stenosis. Very commonly used, mitramycin is used for hypercalcemia. Then L-aspergillus for ALL. It's a bone marrow sparing enzyme. And then remember thalidomide. It was outdated, but now we are using it for immunomodulatory and anti-cancer property, mainly used in multiple myeloma. And also it is used in aphthous ulcer, that is Behçet disease, archival ulcer, and also drug of choice for recurrent ENL, right? And we have lenalidomide, which has less adverse effect but also lacks teratogenic effect. Arsenic trioxide is a differential. Arsenic trioxide. Okay, let me repeat here. Arsenic trioxide. It is also used in AML M3 stage. We have all trans-retinoic acid, which is called as differentiating agent, and which will differentiate the cancer cells into normal cells. So these are the things what we discussed in this video. Okay, so that is about non-cell cycle specific anti-cancer drugs.